All right, we are back. Now my software looks like it's working. I am so sorry for those of you that were joining us live. I created a new live stream, so I'll put the links up and everything in case you caught the old one. But I am not 100% sure if my software was working. So I am back on. So sorry, bear with me for technical difficulties we're having here in the office. So let me start over again because I'm probably going to delete the last video so that in case you're catching this from the beginning. Welcome to today's live stream. Okay, Miss Sharon, I have a comment now. That's what I was looking for. And I have feedback from my audio system here as well. Welcome to today's live stream. We're going to be talking about the 7 most common reasons for hip pain after having a hip replacement surgery. And so the reason that I brought this topic up is because the I got a comment from a guy named he goes by the username GetMoreForYourCar, Bob. So I'm going to call him Bob. Bob said, "I've had a hip replacement last June, and I've had so much pain since. The pain is worse now than the pain is worse now than before I had the procedure. Sometimes when sitting, it can feel like the pain works its way around and up to my lower back on the side that I had the hip replacement. Any ideas on how to help with this pain? I am in the UK. All my consultant has suggested is that he will refer me to the pain team at the hospital. It's like they're not interested at all now." That is really terrible. I'm so sorry that you're going through that, Bob. To answer this question, I'm going to start to cover the 7 most common reasons for hip pain after having hip replacement. The first one is directly for Bob. What it sounds like you're dealing with, Bob, is if you just understand the anatomy here. I'm going to tip the camera down just a bit. There we go. Here's the ball and socket joint of the hip. So there's the ball, there's the socket. The ball goes into the socket just like that. This whole bone up here, it's called the iliac bone, and it forms the socket right here. And so when you have a shift in this bone, because that can happen, you can change the position of the ball and socket joint as well as change the tension in all the muscles in this area. And you can begin to get pain in the back of the hip right here. So this would be like almost like the butt area, the top of the glute area, and into the lower back, because where these two bones meet, that's called the sacroiliac joint, right in the crevice in there, and the crack in there. You can see it better on the front. There's a crack, a little line right in there. That joint is painful when it gets stuck and this whole bone shifts, and it can cause that lower back pain and pain that radiates around the area. And it usually isn't anything wrong with the hip joint. That's probably why they're kind of dismissive with you, or they don't want to do anything else with you. And the fact of the matter is that this is what I just described to you, that pelvis bone shifting. It's not a typical diagnosis or typical information that people know about in the healthcare industry. I see medical people in my office all the time for treatment. And when I describe this thing that I just described to you as their diagnosis, their reason for their back pain or their hip pain, whatever they're going through, they're like, those bones can shift and I'm out of alignment. A lot of people are, it's new information to them. So that's probably what you have going on, Bob. And what you have to do is go find a specialist that knows how to fix that. Your specialists are going to be a manual therapist like what I am. If you don't have one in your area, because they are kind of rare, a chiropractor might be able to help you out. So you might go check out a chiropractor and tell them about this pelvic alignment issue that I'm describing. They often will look at that and they might be able to correct it for you. Of course, let them know that you have a hip replacement, so they're not doing anything crazy to your hip joint, because there's certain motions that you need to avoid or be careful with if you've got a hip joint. So I hope that answers your question, Bob. For those of you that are here with us live right now, I'm going to go into 6 more common reasons for hip pain after you've had hip surgery, hip replacement surgery. But let me know that you can hear me. Thanks, Ms. Sharon. You said you can hear me loud and clear. Dickin Worsley said better. And I'm sorry, I can't pronounce this name. Starts with a B, Vored. I'm not sure what you said there. But let me know where you're from. Just type in there what country you're from. Or what part of the world. If you're in the United States, what city you're from, or any part of the world you're in, let me know what city, state, country you're from. I'd love to hear about it. And if you have any questions, of course, regarding hip pain, hip replacement surgery, or anything else, even if it's not related to hip pain, I'll be happy to answer it as well. I've got about another 15 minutes or so we can cover this information, and I'll stop and answer questions along the way. So let's get into the next one. So the next most common reason for hip pain after hip surgery is a pinched nerve. So you can see on the back of the skeleton here, all these yellow things that come off the spine and the tailbone. There's a bunch that come off the spine right in here. Some of these nerves run around the hip joint. They run on the front of the hip joints. You have a bunch from your low back that can cause that. And so a nerve can get pinched in several places. The most common or infamous one that we know about is a disc problem. If you have a herniated disc in one of these, these are the things that are between the bones of the spine. The disc herniation can compress the nerve and pinch it, and that can cause pain, not only in this area, sometimes it doesn't even cause pain in the lower back, but it radiates or it goes somewhere else, it travels in the body, and that can cause hip pain. And the common presentation for this is they'll do an MRI, they'll find that you have a disc herniation. Typically, if you've had a hip replacement, your doctor's going to do an x-ray on your hip first to make sure that everything's normal inside the hip joints. And then that's when they'll start to investigate other areas. Ms. Sharon is from Montreal, Canada. Awesome. Thanks for joining us, Ms. Sharon. Okay, so the next one, let me get my notes up here. Oh yeah, to keep going with the pinched nerve. So this is related to Bob's answer that I gave. When you have this bone that's shifted right here where my finger's sticking out, right where this bone curves, that curvature is called the greater sciatic notch of the iliac bone. The sciatic notch means that that's where the sciatic nerve pops out. And what isn't shown here on the skeleton, because it's just bones and some nerves, there's a big massive ligament that covers up the other side of this notch, making a hole in this area. So if this bone shifts in some way, it'll pinch the nerve right there too. So in case you go to the doctor and they say, well, your hip looks fine, there's nothing wrong with your hip, your replaced joint looks great, and then they do an MRI and they're looking at your discs in your spine, they say, well, that looks fine too, you don't have any disc herniations or nothing that we're concerned about, you could be getting a pinched sciatic nerve, and it hurts typically right back here in the butt area, or it can radiate down into the hip joint and into the thigh as well, the front of the thigh, the back of the thigh. Typically the back and the outside of the thigh is the most common presentation for this. Now, the next one would be an actual problem with your hardware. So the third most common reason for hip pain after surgery is having a problem with your hardware. They'll do an x-ray and they'll let you know that it's shifted or that the alignment's off of there. It's really rare. I wouldn't say that's the one of the more common ones. These aren't in order, by just to let you know. I just kind of slapped them up there, but I'll tell you which ones are more common and which ones are not. Like this hardware loosening problem or any hardware problem with a hip replacement surgery is quite rare. You have to really be rough with your hip in order to affect the hardware. That, or if you have like an osteoporosis problem, a bone density problem, or if you've been in some sort of accident of some sort, then you're more likely to have some hardware loosening problem, like some people that are in car accidents or have some really bad falls. That can definitely set up a hardware issue. Andrew's got a question. So if that bone where the greater trochanter is rotated, is that a problem? So the greater trochanter is this big chunk of the bone out here. Yeah, it'll be rotated this way or that way. It's hard to diagnose that, diagnose the hip getting pinched or feeling this end of the bone. It moves so much. I wouldn't use that as a landmark for diagnosing any sort of problem, but you can have pain out here in this region, which I'm going to talk about here in just a moment. You're getting ahead of me, Andrew. All right, the next most common problem, number 4, is a muscle imbalance. In the hip, you have tons of muscles. You have a bunch of glute muscles in the back right here, glute maximus, medius, minimus. You have the TFL muscle kind of more on the outside. And then you've got a bunch of deep rotator muscles like the piriformis. There's 2 gemelli muscle and 2 obturator muscles and quadratus femoris. Those are all the muscles just on the back and outside. Then you got a bunch of groin muscles, your inner thigh muscles that run through the knee and inner thigh right here. And they attach to the inside of the pelvis bone right here. And then on the front, you've got some hip flexors. and all of these control motion of the hip. But if you have an imbalance between these muscles, meaning they're stronger on one side than on the other side, then you can change the position, the alignment of the ball and socket joints. Now, if you've had a hip replacement, then the alignment should be pretty stable. The joint itself should be pretty stable, and you shouldn't have a lot of alignment problems. Plus, feeling pain in the actual joint is theoretically not possible as far as the cartilage, because it's not there anymore, and the ends of the bone, that's not there either. But there's other tissues in the area, ligaments and muscles in the area that can be painful, and that's that muscle imbalance pain. And more specifically, what you might be dealing with. So the let me see, we're on number 5 now. Hip bursitis. This is what Andrew was talking about. Pain on the outside of the hip right here, right where this is the greater trochanter. Right over the greater trochanter is something called the hip bursa, the trochanteric bursa. And when that bursa gets inflamed, it's commonly referred to as hip bursitis. If you have that muscle imbalance, it can set off a bunch of problems. One of those is hip bursitis. So a lot of these glute muscles, they attach right in this area, and right under the attachments, the tendons that run into this area is that bursa. And so if you still have that remaining muscle imbalance in your hip after you've had a hip surgery, a replacement surgery, that bursa can become very irritated. It's usually point tender, meaning if you find the tender spot on the outside of your hip, and it's really easy to find this greater trochanter. Let me just show you on the skeleton. It's the outermost part of the hip, not quite up as high in the hip bones, but more on your thigh. So if you rotate your leg in and out, you can usually feel this big bump of the bone moving. So like mine is right there. I can feel it right there. So if you find that greater trochanter and you just poke around it, if you have some tenderness in the area, especially if it's really, really tender, then you probably have some hip bursitis. Wally Yee had to log back in, missed last 15 minutes. Oh, I'm so sorry. You can replay this, by the way, Wally Yee. Excuse me. For everyone who didn't get to come back in, I'm so sorry. Amanda Morris Miller, late to the party. Hello from Louisiana. Hey, Amanda. I had some technical difficulties with the audio, so I'm restarting this. I'll go back and fill in the description and everything for the video. I just had to quickly start another live stream for this to work properly, but I'm getting feedback that it's working right now. So if you have any questions about anything, please ask on the chat here. We've got just about another 7 minutes or so before I got to head out and treat the next patient. All right, 2 more things I'm going to cover, 2 more reasons for hip pain after having hip surgery related to the bursitis, hip tendonitis. And by the way, I've got playlists of videos for a lot of these problems in the description. I'll update it because this is the retake. So if it's not there right now, it will be very soon. I'll do it before the end of the day. Going back to hip tendonitis, right here where that bursa is, right above the bursa or superficial, closer to the skin, is going to be a bunch of tendons. And just like I showed you to find that greater trochanter by rotating your leg like this, if you have point specific tenderness, that's bursitis. Usually right above that is where the tendons are. And those tendons, they'll become point tender as well, but it's a little more diffuse, a little more widespread, the pain from the tendonitis. And then it typically comes on with more activity. And if you move your leg a certain way, like if you move your leg outwards, it'll tension that tendon and set off the pain. So that's how you can know that you've got more of a tendonitis problem. And you can still get that if you've had your hip replaced. Just a few comments going on here. Hit that thumbs up, people. Yes, thank you, Miss Sharon. Please give us a thumbs up. It helps us get more visible here on YouTube. And share this, by the way, too, later on, even after this recording is done. If you can share this with somebody that you know, that helps us to get more visible on YouTube as well. Ms. Sharon said, I was told the first 4 days are the worst after surgery. Yeah, it definitely is pretty tough initially after surgery, and they make you stand up. You have to start walking around and putting some weight through the replacement, so that you can activate the muscles and start to wake up all the tissues. And always close everything up after having hip replacement surgery, but they get you moving ASAP, and you have to, otherwise you can develop all kinds of problems. So if you're signed up for hip surgery, best of luck to you. Hopefully it's the best thing that you need right now. Some people need it. Some people can get away without it, depending on the severity of their hip arthritis and what's going on. But if you're going to have it, good for you. Be prepared for lots of pain and discomfort, and take your pain medication. I know I say don't take pain medications on this channel a lot, but there's times when you should take pain medications. And if you've just had a hip replacement surgery, you bet that's a temporary situation that you're going to recover from eventually. You should heal. And so taking some pain medication in the short term is a good idea, so that you can get through the initial days, couple of weeks, few weeks after the surgery, and you're not in agonizing pain. Because if you're in a lot of pain, you're not going to sleep well. And if you don't sleep well, you're not going to heal well. So moving around and getting enough sleep is like, you have to find a balance between everything. And the pain medication helps you to keep that balance of rest and movement as well. So I hope that gives you a little more insight into what a hip surgery is like, Miss Sharon. Let me answer a few more of these questions. Lakshmi, Thai massage, okay to receive after hip replacement? I've had a Thai massage before, and it's a very active massage, and they move you around quite a bit. I would not do a Thai massage after having hip replacement, unless you know the massage therapist, or maybe you've seen the massage therapist before. And for those of you that don't know what a Thai massage is like, go look up the videos for that on YouTube, and you'll find exactly what I'm talking about. They're putting their feet on you, they're digging in. If they're gentle, then you might get away with it, but there's certain motions you should be avoiding if you have a hip replacement surgery, like rotating your thigh inwards, like this. So where your foot goes out and your knee goes inwards. Your doctor will tell you, if you have a hip replacement, what motions you should avoid, especially right after the surgery. But yeah, it's definitely an active massage, and so I would proceed very cautiously, maybe even not do it. There's other types of massage out there that would be much more appropriate if you're looking for a massage. And a massage is a good idea, especially if you have very stiff, tight muscles after you've recovered enough from a hip replacement surgery. And usually that takes months. Okay, Manda Morris Miller. So pleased and grateful for all this info. Thank you so much. You're very welcome, Manda. I'm happy to do this. Wally Yee, this is my first live stream. I email 17 February some questions to Amber. Oh yeah, that's my ops manager, which she was going to forward to. Can you follow up, please? Thanks. Oh, so sorry. We have Wally Yee. I'm so sorry. We are backed up on email. Between running a full-time practice here you're in my clinic right now. It's pretty tough to get all the questions answered, and so that's part of the reason why we do these live streams. So if you want to ask your questions on here, we can't treat you over the internet. Legally we have restrictions for where we can treat. So people can be coming to the clinic and get treated here. If you live in Texas, which is where we are, then you can get treatment online through here, through our clinic. But you have to have an identification with your Texas address, just so that we know that it's all legal and works. So I'm sorry, Wally Yee. We'll get to it eventually. I have to go in order with all the messages that I get. And so those of you that are on here that may have gotten a response from me, I do get back to just about everyone eventually. But it is slow going as I'm doing a lot of it. And I've got a content media manager that helps me out as well, here and there with comments that are appropriate for them to answer. But I, answer the more technical ones like these. So send me the questions. I'm happy to answer, or bring them up here on a live stream, and I'm happy to answer them here as well. Miss Sharon, I was told by the surgeon you can go home the same day. Depends on the person's. Yep, it really depends on the person. But I've rarely ever seen that. I think I've just seen that once my whole career, and it was a very fit individual who had hip arthritis. Most people are staying a few nights in the hospital after having a hip replacement surgery. Highway 138 says, I'm having hip surgery tomorrow. Wow, we wish you the best of luck. Everyone on the call, Please wish her luck right now out loud. Just say, good luck, Highway 138. I wish you the best of luck in your recovery. And I hope that everything goes very smoothly and that tomorrow you feel better and that it's the best, easiest thing that ever happened to you. We got people chiming in on the chat here. Good luck, Highway 138. All right, let's get to the final issue here that we need to talk about. The final reason for hip pain after having a hip replacement, and it is IT band syndrome. It is a more common than you think diagnosis out there. IT band syndrome, it's kind of in line with bursitis and tendonitis, but more to the front outside part of the hip right here. So like where your front pocket is in your pants. So right here where my hand slides into my front pocket, that's generally where the IT band starts. It starts on a muscle here called the TFL, tensor fascia lata. And then that IT band runs down the outside of your leg and it attaches right down here at the knee. So if you've got this problem up here in the front pocket area, pain, tenderness, stiffness, and it's more superficial rather than deep, you may also have some pain associated with that on the outside of your knee or anywhere on the outside of your thigh. This happens quite a bit. It's often confused with sciatica symptoms as well, like pinched nerve problems. But IT band syndrome is usually very fixable. So if you have any of these problems, they're very fixable, with the exception of the hardware loosening problem. That's more of an invasive fix. Of course, you have to go talk to your surgeon. But all the other issues, the bursitis, tendonitis, IT band syndrome, the muscle imbalance, the pinched nerve, the shifted pelvis, all of those problems are usually fixable, and you don't have to lose hope if you still have hip pain after having had a hip replacement surgery. So, for you, Highway 138, HWY 138, you're gonna be on the path to recovery here starting tomorrow and the day after, and it's gonna take you several months to walk normally again, and it'll probably take you like a few weeks to walk normally again, but confidently with speed and get all your strength back. That's going to take a few months. Then the pain should largely subside, and then you're going to have still after effects. All these little things that I talked about could affect you, and you've just got to know. Come back to this video if you don't remember. You've got to know that there's other things that could be happening to you. All those things I mentioned: tendonitis, bursitis, IT band syndrome, all the shifted pelvis, pinched nerves, all those things could still affect you even after you've had a hip replacement surgery. So go find a specialist or check out our videos here on our channel. Go down to the playlists that I've linked in the description below, and you'll find more information for how to treat it yourself or where to go find help so that you can get this problem fixed. So, all right, guys, I am over time here. I'm just going to read the last comment here. Highway 138 says, thanks, I am scared. Oh, that's a healthy fear. But I will say this about hip replacement surgery is they've progressed it quite a bit. It's one of the best surgeries, major surgeries you can get. I mean, it is a major surgery. You're getting a joint replaced. It's close to your organs and all that. But I consistently see people get good results with it if you have to have it done, of course. Yeah, sure, there's risks and there's harms in doing it like any other surgery, but it's a pretty good surgery if you have to have one. The shoulder replacement surgery is not the favorite of people. A lot of people say that it's very, very painful compared to hip replacement surgery or even knee replacement surgery. So if you're going to have a replacement surgery, Highway 138, I think this is a good one to get. Miss Sharon says, Highway 138, good luck. Please let us know how it works out. Yes, comment back or reach out to us somehow. Wishing you a great outcome and not too much pain. Please give an update as to how it all went down. Good luck. You will be okay. Lakshmi Yu says, Highway 138, you'll be pain-free after and wonder why you waited so long to have it done. Hopefully that's the case. Amanda Morris Miller says, are the shots beneficial? Shots can reduce the pain temporarily. If your hip arthritis is just so far gone that your hip's locking, you're getting lots of grinding and noises in there, and it hasn't improved despite you trying exercises and stretches, going through physical therapy, fixing the root of the problem, like getting the glutes stronger, then a hip replacement surgery is likely going to be a more positive outcome for you. But if you have benefited from exercises and stretches, and you have times when your hip feels better, then you might need to double down on doing the right exercises and giving it its adequate time. And in the meantime, getting shots could be beneficial, like a cortisone injection. There's a bunch of other shots you can get. Cortisone injection is going to be the most common one. It's a pain reliever and an anti-inflammatory one. So I hope that answers your question, Manda. All right, friends, I've got to get going here. If you go check down the description below, you'll find more helpful videos on all these 7 common reasons for hip pain after hip surgery, hip replacement surgery. I hope this was beneficial for you. Give it a thumbs up if you thought it was, and we will see you in the next video, friends. Bye-bye.